Welcome to the Community Pharmacy New Revenue Roundtable. My name is Breck. I will be your host today. We'll have some other guest speakers that will share with you as well. But I've been helping community pharmacies now for over 20 years. Absolutely love our community pharmacy partners and have been really enjoyed my career in working with community pharmacies, and I'll do everything in my power to help you all be successful and be able to get fair reimbursements. And so I've been on that third party side. We'll talk a little bit more about that in just a minute, but back during the pandemic, when Fortune put this report out about how many of our independently owned pharmacies were closing their doors, that really was worrisome to me. And so I really wanted to do something to help our community pharmacies more than what we were doing, because our little piece of what we do at ServeRx, really is we can only get involved with community pharmacies maybe 1 or 2% of the time for the most part, because most independent pharmacies don't see a whole lot of workers' compensation claims. And so I wanted to do something else. And so being here, knowing a lot of people in the industry, I put on my consulting hat and I said, okay, well, let's do something different. Let's see what else we can do to bring new revenue to our community pharmacies. And that's why we started these roundtables. We sometimes even refer to them as new revenue roundtables. So thank you for being here. Hopefully there's some information that will help you in your pharmacy today. And also, please put yourself on mute unless you're going to be one of the presenters here, so that it's not distracting to the group. But this was the first thing that came out that really kind of shocked me, is that we finally dipped below the 20,000 mark with independent pharmacies. And I get updates on a regular basis. I just sent another one to DeMar this morning of another store closure. And so I get regular updates. And the main reason for pharmacies having to close their doors is just the poor reimbursements, and then the darn DIR fees. Back when I first started, your profit margin was around 36%, and today at 3 to 5%, it's pretty hard to stay in business with those low margins. And then put on top of that a DIR fee, and it's really, really hard to stay in business. And so here's just some of the most recent closures. You've got the 3 locations in Jefferson City that just closed after 80 years of being in business. The Tillamook store just closed this month. You've got this drugstore desert happening with a store that just closed, and after being open for 106 years. And then the one just that I got notice this morning will close on the 30th of this month, and that's Blake's Pharmacy out in Nebraska. So really, really sorry to see these stores close. And again, here's another one of those reasons why, and that's the financial impact of not just low reimbursements, but then these darn DIR fees. To put that into some perspective of how much the DIR fees have increased, over 91,000%. So that would make like a gallon of milk cost over $3,600, so $3,600 for a gallon of milk. Just doesn't make any sense at all. And I know I'm preaching to the choir here. You all are aware of this, but we firmly believe that our community pharmacies need to adjust. They need to start looking at other ways of bringing in revenue, and 1/3 of that should be non-dispensing revenue. You can't put all of your eggs in that dispensing basket if not only are you only getting 3 to 5% profit margin, quite often you're asked to dispense a medication below your acquisition cost. It's insane. And so we feel like you need to start looking at programs to bring in more non-dispensing revenue, about like I said, about a third or 33%. You can see that the chains have started to diversify that, and they're only at 71% of dispensing revenue. But your mass merchandising pharmacies or your supermarkets, of course, they have all the front end grocery sales and everything, and that's why they're only dependent on about 7%. Obviously, can't go that deep, but if you could get to a 30% or 33% of non-dispensing revenue, you're going to be so much more healthy as an organization. So we've identified about 16 different revenue streams for you today, and more are in the works. There's more that are coming. And so it's a lot of information. I know. Just pick one or two things that will help you at where you're at today currently, and let's just focus on those couple of things. One of my favorite quotes here. I used to live in British Columbia, Canada for a while, so hockey's the NFL of Canada, and so we follow hockey quite a bit. And one of the greats is Wayne Gretzky, and when he was interviewed and asked why he was so much better than most of the players on the ice, this is what he said: he skates to where the puck is going to be, not where it has been. And that's the kind of attitude we need to have as community pharmacy professionals. We need to go to where the profits are going to be, not where they have been. And the very first revenue stream that we want to make sure that everyone is utilizing today, this program is 100% free for you to use. Your PSAO has probably already signed you up. You just need to enroll. We are the preferred provider for all of the buying groups and PSAOs in the country. And this is how you bypass the PBMs every chance you can. And here to tell us more, hopefully, Will, your mic is working okay. Why don't you give us a test?
Good morning, good afternoon, everyone. Can everyone hear me?
Yeah, it's much better.
Perfect. Like Breck said, this is a great program for pharmacies, community pharmacies. Best thing about it, it is free 99. There's no cost at all, right? ServRx, we love community pharmacies, and it's a great revenue stream right here for pharmacies. Workman's comp, we have no affiliations with the PBMs, so we're able to maximize the pharmacy's reimbursement on these workman's comp claims by keeping them out of the PBM networks. As you can see right here in our examples, for example, you have a patient with come into your pharmacy, they would need a meloxicam. If you were to process that meloxicam through a PBM, like Temesis, etc., your pharmacy may be reimbursed $3 to $4 for that medicine. But if you was to adjudicate a workman's comp claim that meloxicam through ServRx has been a PCN, your pharmacy could be reimbursed anywhere from what I've been seeing lately is $101 to $103 for that meloxicam, and that will be reimbursed to your pharmacy in 30 days. If you are with a PSAO, it'll be reimbursed to your PSAO Central Pay, or if you're an independent pharmacy, ServRx will pay you directly for those workers' comp claims in 45 days. We do have a live help desk that is available 7 days a week. So if the pharmacy was to receive a rejection for a claim, you could give our help desk a call. Okay. Again, this is a free service that is available to every pharmacy out there. If you're not enrolled, I can help you get enrolled. It's just simple, just enrollment form through a sign now document. Okay. You have anything to add to that, Breck?
No, just again, it's there to help you bypass the PBMs every chance you get. We understand fully that the PBMs do bundle a lot of their networks. So if you are participating in serving United Healthcare patients, they kind of hold a gun to your head and say, okay, if you want our 65 million lives on the health side, you're going to take all of our PBM networks like Cypress Care, Catamaran, and now they're even trying to bundle Temesis in there. But still, there's about 1/3 of all workers' comp that is self-insured employers, meaning that the employer is managing it themselves, so self-insured, self-administered. And those are the claims that we can process for the life of the claim. About 50% of the claims will have 10 or 12 refills. And so why get paid only $4 10 times when you could be making, 50, 60, 70, or even $100 like Will has mentioned. So again, free service to you. If you're not enrolled, reach out to Will and get signed up immediately so that you have our BIN and PCN in your pharmacy system. As an appreciation, ServRx has a couple of fun events that are coming up. We want to invite any of our community pharmacies and their families. If you are in or around any of these locations, November 6th in Las Vegas at the T-Mobile Arena. Also on November 10th in Charlotte at the Spectrum Center, and then in San Antonio on this December 16th, and then finally back here in Phoenix on December 20th. And so, if please reach out to either Will or I for more information to participate and attend that. Totally as our guest, we'll have a big, nice suite, and you can come and enjoy some basketball. This is in conjunction with the Basketball Hall of Fame, so all the NBA Hall of Famers, but this is their college series. So a really fun time to get psyched and excited for the upcoming basketball season. So come be our guest. All right, so moving on, want to talk about a program that has 10 revenue streams, all bundled in a nice little package, like a clinic in a box. This is similar to the retail Minute Clinic concept, but it's like the Minute Clinic on steroids, to be honest with you, because this group has put together a program that combines conventional medicine with complementary integrative medicine technology, artificial intelligence, bioelectronic medical devices, all to help patients not just feel better, but actually get better, or prevent the disease to start with and live longer. That's why it's being called the Fountain of Youth. And this is a program that, like I said, has 10 different revenue streams all bundled in it. One of the first revenue streams here is in doing what you're already doing. If you're already providing vaccinations and billing for those vaccinations through the pharmacy side, you're only getting a fraction of what the reimbursement is. So you can see here's an actual reimbursement from one of our pharmacy clients that did almost 10,000 flu shots last year and got reimbursed about $167. After credentialing, they'll be able to get almost $1 million. Okay. So an amazing program. We're going to hear a little more about credentialing here in just a minute from our expert, Candy. The second revenue stream, this is the one that I think everyone should automatically get enrolled in, because again, it's not going to cost you anything at all to participate. And this is actually helping with a public health service, something I didn't realize was such a big issue, but evidently 1 in 5, according to the CDC, 1 in 5 Americans has an STD. And I also guess they're called STIs now because an infection isn't quite as threatening as a disease. So a sexually transmitted infection. A lot of the numbers, about 45% of the 65 million people that this that this affects are college age. So if your pharmacy is anywhere near a college campus, community college, university, any area where youth from ages 16, 17 to 24 are gathering, this is needed. Today, there's some embarrassment for patients to actually go get tested. And so this program is going to help with that. It is a very discreet kind of a HIMSS approach to getting tested, where they can literally scan a QR code from your pharmacy. You have a unique QR code assigned to your pharmacy. The patient scans that. The home test is delivered right directly to their home or to their dorm. They get a sample, send it off to the lab. If it comes back positive, then the lab sets up a telehealth visit if they want. So again, keeping it very private. They don't have to go in to their primary care provider. They can just do a telehealth visit. You'll be the pharmacy of record, and so they'll send that script to your pharmacy for pickup. Not only is it generating more foot traffic and prescriptions to your pharmacy, the lab pays you a referral fee for every test that is ordered. It's like $10 to $15 per test. I think it's mailbox money. It's like the closest thing I can find to mailbox money for our pharmacies. So make sure you get on the list to participate. This program starts in about 3 or 4 weeks, and so they're just gathering up the who wants to participate now. So that's FOI revenue number 2. FOI therapy revenue number 3 is the virtual care. This is the actual, the actual patient visit with a telehealth provider right there at your clinic pharmacy in order to take care of any acute needs that the patient has. I'm going to be quiet, let this next video run to talk about the fourth revenue in FOI.
According to a recent report from Pharmacy Times, one size evidently does not fit all when it comes to medications. The pharmaceutical industry has produced some blockbuster medications, but has remained unremarkable at the patient or the individual patient level, with only an estimated 30 to 50% of patients fully responding to many of the leading conventional drugs. Some treatments just don't work for some patients. Did you know that 99% of the population has at least one variant in their DNA that doesn't allow them to metabolize certain medications? The way patients respond to treatments is heavily affected by their individual genetic makeup, variables, and complex biology. We now have the science to personalize treatments. For more information, please join the Facebook group.
So there are over 100,000 patients that are following this content now. And so we needed to set up some place to start funneling them until there are more FOI locations or Fountain of Youth locations set up. So we are sending them into this Facebook group called Healthcare Disruptors to try to get them help and ready to direct them to your pharmacy as soon as possible. So the fourth, like I mentioned, is the pharmacogenomics, the fourth revenue stream for Fountain of Youth. And we have a lab that is participating that will pay your pharmacy $110, which is for both the collection and the consult for doing pharmacogenomics. Not every insurance is covering it yet, so we're really trying to help bring down those costs of the comprehensive PGX tests. But right now, you can earn $110 for doing that. Medicare will cover for patients that are on multiple medications. If one of the medications is a psych med or if one's a heart med. So there are some insurance billing, but still a program that we think is going to really change healthcare and really get to helping patients at a personal level. So like, that's been brought out a couple of times here, the efficacy of even the best medications, are not 100%. They're 30%. Pharmacy's Time said between 30 and 50%. I think that's pretty generous. I think it's probably closer to the 30%, meaning that 70% of patients are on a medication they're not getting any of the intended benefit from, but they're still getting all the negative side effects. So another great program for generating revenue. Fifth revenue stream in FOI is blood analytics. All of these things that we're sharing with you, with the exception of our service from ServRx with third-party claims processing of workers' comp, these are all services that we don't get anything from this. And if we do get a discount, in this case here, you can see that there's a coupon code that you can use to get 10% off the software. We want that to go to our community pharmacies. We want you to be able to benefit on anything that's been offered as an incentive to us. We just do a straight pass through to the community pharmacy. So an amazing program that can actually look at blood markers to identify deficiencies to help patients not only make better choices, but it will help increase your nutrient cells as well, because you're going to see that people are low on iron or zinc or other deficiencies, and this will identify that and help them. We've got a really amazing nutrient program that is being investigated right now that customizes that for the individual patient as well. So really talking about customizing a patient experience and making sure that they're whatever they're deficient on is getting replaced immediately. That's more to come, but I wanted to show you a quick video here that shows a bioelectromagnetic energy device. So this is a medical device that FOI is putting into these clinics that generates revenue not only through insurance billing. There's actually 4 different revenue streams from this, but what it's doing is it's eliminating inflammation. So it's lowering inflammation. It's increasing microcirculation, meaning more nutrients and oxygen getting to the actual cellular level of the patient. And so I'm going to show you a demo of this before stimulation and then after stimulation. You're going to see on the left-hand side of the screen, you're going to see one little tiny, let me just go there and it'll stop. Okay, you're going to see one little tiny capillary here, and you're going to see how lethargic the blood is moving into there. It's almost like it's clogged, not getting into the capillaries. So this is the arterial, right, bringing blood from the heart and lungs, and then this is the veneal returning the blood. And you're going to see here how lethargic, like I said, that's moving in. Okay. After only 3 minutes of stimulation, it's just flowing naturally. After 6 minutes of stimulation, it's flooding in like the Autobahn, and you're seeing more activity with white blood cells. It's not producing any more white blood cells. It's just simply making them more active. Also, it improves the ATP, so cell energy, by 22% as well. So overall vasomotion, 30% increase, and it lasts for up to 18 hours in patients. So this is literally 30 minutes after stimulation. You're not going to see any difference. It's just flowing like it's supposed to flow. So an amazing opportunity to bring that into the clinical setting. Got Slick Willie here, Will Shaw, doing a demo of it, so that you can see what the equipment actually looks like. This is the medical device here. It's like a high-end yoga mat with coils through it. By the way, it's the first of its kind to get FDA Class 2 approval. So it's the only device that insurance will accept for treatment because of its Class 2 approval in this category, the PEMF, or pulsating electromagnetic energy field. But here's the example of the med bed or the mat. Most patients' heads will be about where Will's shoulders are. Will just happens to be really tall. But that's one port is being used for that med bed. And then the second port is going to his ankle right here, and treating a past injury. So he's got some scar tissue in there from breaking his ankle playing over in France when he was with the Globetrotters. And so this helps loosen up, break down that scar tissue, and improves the circulation. So the range of motion is improved as well. So an amazing bioelectronics, the first of its kind. Pro athletes have been using this for almost 20 years now, but finally got approved by the FDA. So now it can be made available to all individuals. They're big, bioelectronics is going to be big business. You've got a lot of people kind of gearing up for that. And so, you've got big pharma and technology giant Google partnering up to develop more bioelectronics. And the Fountain of Youth has the very first one. 10th revenue stream is virtual therapy. So this is another program that is available also in the Fountain of Youth, and can go into more details later on for that, for anyone interested. So just to recap, the 10 revenue streams: vaccinations once you are credentialed, billing on the medical side or the health side rather than just from the pharmacy. Candy will tell us more about the differences in reimbursement there. The home testing program that I mentioned, that's the home health test for the STIs program. Everyone should get enrolled in that. Virtual care, seeing patients right at your pharmacy. The pharmacogenomics is number 4. Blood analytics was number 5. And then the 4 revenue streams from the medical device, insurance billing, cash pay, DME, if credentialed as a DME provider. And then about 1 in 10 patients feel so much better using the device, they want to have it at home. And so then you'll have the opportunity to sell it to them. And then the virtual therapy. So wanted to turn some time over to Candy real quick. If you would tell them about your service and how you help them get credentialed. Are you here, Candy?
Good morning. I am here.
Good morning.
And I'm going to share my screen in just a second here. Breck,
right.
I'm going to send another request to join from my other device.
Yeah, so while and I'm going to have to give you, there we go, multiple participants. Okay, so you should be able to share now, but just everything is all inclusive in the Fountain of Youth, including the credentialing. But Candy is is the expert for that, and that's who I refer all of our community pharmacy partners to. And we were looking at another program that we started with. But the Candy's literally half the cost of what the other providers were charging for the same or similar services, and so we were excited to get partnered up with Candy, so we had someone that we could know and trust to refer our community pharmacies to. And if any of you were at the Pharmacy Badass convention in Dallas, Candy was one of the speakers there, and pharmacies are really starting to understand how much better off they are if they are credentialed on the medical side, because I think last I checked, some of the flu shots are getting reimbursed for over $80 a shot, instead of the $17 to $20 that you're getting today. All right, Candy, take her away.
Thanks, Breck. Thanks a lot. I feel like I have an echo. There we go. All right. So yes, I was at the Dallas conference, the Pharmacy Badass. It was a great experience. Normally when I go to conferences, I'm either speaking or attending, but I was actually as a vendor with a booth this time. So it was really exciting to see lots of faces. I get so many calls and emails, but I don't get to see faces. So it's really good to see that. I'm going to piggyback off of what Breck was saying and kind of piggyback off of the presentation I did in Dallas. For those of you that have saw it, I'm probably going to kind of go straight to the financial numbers, but just talking about what the opportunities are for pharmacy owners, independent pharmacies. There are just so many options out there, and I called it low-hanging fruit because that's exactly what it is. It's low-hanging fruit. And so, some of the things that you can do are diabetes education. There's usually somebody in that pharmacy that has taken that diabetic educator for self-management. There's so many patients. My previous life was a nurse, and so there's so many patients that just don't know how to take care of their diabetes I'm living with diabetes type 2, but I'm non-insulin dependent. And so it's education, it's knowing intake and food and liquids and all of those different things and medications. And I always educate my physicians, and I said, you guys are great with disease management, but you're not great with drug management. That's where our pharmacists come in. So really getting you guys to partner with physicians, but at the same time, you can do these services, some of these services on your own without having to partner with the physician and have another hand in your cookie jar. And so diabetic education is super important. Physicians are not doing it, endocrinologists are not doing it, and the nurses are not doing it. And so there's definitely some low-hanging fruit opportunities there. And in those sessions, you can do them in a group session or individual. You can do them individual. In the long term, is if you're in a rural area, their patient has some type of complications or comorbidities that prevents them from coming into the pharmacy and getting them done, the Medicare will allow you to continue to do those. The second option would be point of care testing. I have so many pharmacy owners that are like, oh, I have a CLIA waiver, and I've got pharmacies now that are doing COVID, strep, mono, the COVID influenza combo, all those different combo tests. It's happening. I mean, I went to the ER just because my local pharmacy was closed end of April, and I ended up testing negative for COVID but positive for influenza B, and it actually hospitalized me. But having these point of care testing opportunities that people could just literally walk in or have almost like self-service hours would be super helpful. Part of the reason why I had to go to the ER is because no one around me in my area, even the local pharmacies, are not doing it. And so by the time I got to the point where I was exacerbating my other conditions, I had to go to the ER, and it turned into a hospitalization for 7 days. And so speaking my truth here of what opportunities that what you can do for the community and offer and educate them on, hey, you don't have to go to the ER, you don't have to go to urgent care, you can come to us, and we have these capabilities for you. The other one is obviously your vaccines, flu, COVID, pneumococcal, any exposure or travel vaccines. You're probably running those through your PBM right now, and you're probably, like Breck said, getting $17 to $22 for those. But our flu shots are coming back about $69, $70. The high dose is probably about $100, including the admin reimbursement that Medicare is paying. And so, again, opportunities there to increase your profits. And so just a little bit of education on the diabetes education. Can you bill for it as a pharmacist? Yes, you can bill for the diabetes education, but you do have to be accredited, and it goes by the person. So it's got to be through AADE or ADA. There's a course and a certification process. And once you have that, we got to take that back to Medicare and let Medicare know you have that. So it goes on your profile so that provider enrollment can add that so that you can bill for those services. I'm seeing so many that either don't have it and they're trying to do it, or the person that has their certification no longer works there. Or the third thing I'm noticing is they have it and they think once they have it, they can just start billing for it and get paid for it. And someone's got to actually go back and notify Medicare that you have that certification so they can accredit the pharmacy itself with that, and then you can move forward. They talk about how many hours that the patients are eligible for. So initially in the first year that you start DSMT, it's not necessarily the first year the patient has diabetes or been diagnosed, but it's the first year that you start providing these services. That's about 10 hours. And then after that, it's 12 hours from there. And so they have really specific rules. And as long as you're in the hands of someone that's really knowledgeable of the programs and the rules and the billing, you'll be successful. And then we have some independent clinical lab. And so, like I said, we have those tests and things like that. Most of the tests that I'm talking about are simple tests that you can run with the CLIA waiver. I have some that are doing simple things like pregnancies. And, I have some that are working with, I have one on the East Coast that's working with the Department of Probation to do the drug test. I mean, think about it. Probation is not, their focus is not testing. They've got a test, but they don't have a lab to test with. And they're always looking to save a quick buck. So if you can partner with the local probation parole and serve as a testing vendor for them to test their specimens for them, that's revenue right there. And people don't even, sometimes it's out of sight, out of mind. So I want to jump into the vaccine billing because that's the biggest low-hanging fruit opportunity with our independent pharmacies. And there's two types of setups with Medicare. And I say Medicare because that's where 99% of the money is coming from and where everybody's pushing. They have two types. We have pharmacy setup and mass immunizer setup. And I think when COVID first struck, everybody kind of shuffled and panicked. And Medicare was just like, here, anybody that wants to help the community and do COVID vaccines, we'll give anybody a PTAN. And that's where that mass immunizer came from. Now it's been 3 years plus, and now providers are having to, roll that into a pharmacy PTAN and things like that. But you are limited with the mass immunizer. You can only bill the flu, COVID, and pneumococcal shots with those. Whereas the pharmacy PTAN, you can bill a little bit more. You can bill Tdap and things like that. And so it's really helpful to have the pharmacy one. I've got some that are doing mass immunizer right now while we're working. My other team is working on getting them a pharmacy one so they can add other exposure or travel vaccines. And then I'm going to give you a good example of, this is actually Breck's example. He had reached out to me when I was on my way to Dallas, and I'm going to use a different presentation because the other one is a little bit bigger where you can see that screen that I want to show you. But Breck had asked me for, and I'm going to slide this, see if I can slide this one over so we can see this better. There we go. He had asked me on, I was literally calling him on my Uber ride to the hotel. And he was asking me about a pharmacy. I can't even remember where they were. I think Oklahoma, Breck, maybe. I don't remember. But this is an example of what they sent Breck. And so when I landed, I saw this in my email. And it's like, hey, I heard that we can do this, we can do the medical billing way instead of the PDM way with our vaccines. This is the number of vaccines we did. This is the products that we did. Tell us what did we do wrong? What are the opportunities? Where's the dropout? Things like that. And as you can see, they did quite a few. I mean, they did flu quad on there, and they talked about what they total profit and what their average profit was for each vaccine. And if I'm not mistaken, they did that through the PDM, the pharmacy benefit. And so I actually took this number once I got situated and I was kind of putting my booth together. And I'm going to slide just this slide over because it's a little bit bigger to see. And someone said you can't see the screen. It's not sharing at all?
Yeah, we're not seeing your screen.
Okay, hold on. Let me go stop sharing and let me go share it again.
I'll stop sharing, maybe. There we go.
Okay.
There we go.
Let's go back. I think you were sharing and I was sharing, but you were overriding, Breck. Sorry about that. Thanks for the notes,
I am
guys.
overpowering sometimes, sorry.
Okay, so this was the original request that Breck sent to me. I'm going to go back a little bit on the flu quad, flu block, flu zone, high dose, and all of those things. And those were the numbers that they had did in the last flu season. And so I took those numbers and looked it up in their area, which I believe they were in. I'm going to try to zoom this in for you guys a little bit. They're in Oklahoma, I believe. They were in Oklahoma. Trying to get it a little bigger without losing. Okay. And so I took what they gave me here at the top and I gave it to them. Like if we were to bill it, when I say the medical billing way, think about when you take yourself to the doctor, your family member, or anybody, you give them your insurance card, you probably fill out a whole bunch of paperwork, and then they tell you that you have a copay or a co-insurance, da-da-da-da-da. They try to collect that up front. That's basically the same process, the same infrastructure that physicians and surgeons and therapists are using and mental health providers. We would be doing the same thing with you. And so we say the medical billing way because we actually have to have the infrastructure and the software and the skill set to be able to bill and the wherewithal to be able to deal with the insurance and the forever changing rules and guidelines. And so I took those same numbers and I showed them what their profit would have been had they just billed it out. And so I let them know that your flu quad was your cost, but the average reimbursement for Medicare for this was the last flu season, so the 2022-2023 would have been $71.68 plus there's an admin, basically like a markup, so to speak, for doing the vaccine itself. So they pay you for the vaccine that you pay for plus doing the vaccine itself or giving the vaccine. And so when you add those two together and I subtracted their cost, their average profit went to $87.95 compared to $18.50. Same with the flu block. They went from $12.86 to $39.60.
Yep.
Flu zone, we went from $12.42 to $39.67. Fluad, we went from 1976 to 47, and Flucivax, which is usually our popular one, went from 2140 to 8331. So just right there, again, I call that low-hanging fruit. This is stuff that you're doing every day in your pharmacy. There's your opportunity right there.
Yeah.
Now I've got pharmacy owners that are, not only are they capturing these types of reimbursements, but now they're going into, I've got one in Baltimore. She's got 2 pharmacies, and she's going to like 80 nursing homes because nobody goes to the nursing homes. Those patients need their annual flu shot, they need their pneumococcal every 5 years, and they need their boosters. And so again, low-hanging fruit opportunities here of what that looks like. And I included pneumococcal because I don't think that Breck had included pneumococcal when they asked, but the pneumococcal rates, now these are obviously, we're in a new flu season and all of those things, but this was the pneumococcal rate as of April. They do change every quarter. This is the national rate, so this is pretty much across the board. And so the pneumococcal,
Candy,
most of my, yes, go ahead, Breck.
You'll be at NCPA, right?
Yes, we'll be at
so,
booth 125.
Yeah. So we have a couple more presenters we got to get to, and we're running out of time here. So please make a point to come see Candy at NCPA if you're going to be there. Also, she'll put her information up in the chat, and you can reach out to her obviously before then too as well. But yes, please.
Yep. I will put it in the chat for you.
Yeah, we better move on. So if I can
Thanks, Breck. Thanks, guys.
Sharing here. All right. And let's real quick. Thank you, Candy. Appreciate that. A couple more presenters I want to make sure we get to and keep this under the hour. Also, financing has been lined up for our community pharmacies too. 0 interest for 15 to 18 months. So I can get you in contact with that group too. This is an amazing opportunity to an 11th revenue stream to identify patients' health levels. It measures the antioxidants in patients. And I think pharmacies are generating about $70,000-$80,000 a year with this program. And then I'm super excited about this product because I have personal experience with it. I wanted to show you an actual wet wipe size because you'll understand my story with this real quick. That's the size of the wipe. So you can see just one handy wipe. I was able to traveling during COVID with my grandkids. I wiped them from head to toe with this totally safe water-based product, wiped down the plane seats, the buckle, the tray table, everything I knew they were going to play with. And we did not have any problems with COVID during that travel. Our COO took his family at the same time. They got an extra 2 weeks of quarantine because they didn't take the same precautions. Amazing product. I love it. Scott, can you really quickly tell us how to get in contact with you and what this product does?
Sure thing. Thanks, Breck. The main difference is that it's a water-based product instead of chemical-based product. And that's why you could wipe so many things off, because the alcohol wasn't evaporating, because it's a non-alcohol product. So it doesn't evaporate very quickly, and it does a covalent bonding with the skin or with the surfaces, and it lasts 4 hours or more. Unlike the normal hand sanitizers, alcohol-based, as soon as that alcohol dries in 20-30 seconds, there's no residual value, and your hands are all dried out and sticky and smelly, and this has no fragrance, no residue, no anything. It really is a breakthrough in technology. And so 2 things for the pharmacies: that if you're working with Breck on the Health Hub, you're going to be able to disinfect and sanitize your areas very quickly, and the antimicrobial disinfectant will last 28 days. The EPA allows me to say that because the tests show way longer than that, but I can, on the labeling shows 28 days persistent continual efficacy in killing pathogens. And so I'd love to, I put my information in the chat already. Just that now you can kill germs physically, not chemically. And the other thing is that we're just starting to get display cases for selling the product in the pharmacy. Whether you want to do that or not, it's up to you. The profit margins are pretty good, I think. And it's you can feel good that you're not poisoning your patients, because that's how we kill germs now. We poison them. And now we have a different way of doing it, and it's FDA and EPA registered and approved.
Yeah,
That's not
excellent.
correct.
Yeah, that's awesome. And it's profit margins are high 40s, even 50% on some of the products. And then the 13th revenue stream, I hope you all are aware of this product now. Amazing, amazing product. And Chris, are you here?
I am, Breck.
Awesome. Thanks, Chris.
Yeah, so thanks for having me, Breck. What BioLite is, it's the first drinkable oral IV bag. So essentially, Dr. Rollins here, he created this when his wife Janine was going through breast cancer and chemo treatments, and really helps with anything from dehydration symptoms and nausea. So, obviously we're coming out of the summer with heat exhaustion and getting into the fall season where people are dealing with cold, flu, COVID, stomach bug, things like that. So excellent product to keep in the store in the front, can connect it to plenty of people in the community. And we are about to run a clinical trial on BioLite's impact in oncology patients to be able to publish some data and start talking to some of these healthcare partners at different segments, and trying to send people to your stores. So we really want to support the independent pharmacy first, and we're going to be educating nurse practitioners, PAs this winter about acute dehydration when people are sick, and giving them access to the pharmacies that are stocking BioLite. Love to work with you. If you have any questions, please reach out.
Yeah, get it right through your wholesaler now. Chris was kind enough to send us some cases to take out to NACDS. We had vendors coming up saying, "Oh, we heard about this. I absolutely need one." We might have overdone it a little bit last night. So it's also good for hangovers also, evidently. So also the 14th revenue stream, I want to welcome Jonathan to tell you about this amazing product that is launching at NCPA. So it will be there in just a couple of weeks. Jonathan.
Hey folks, good to be with you. I apologize, I'm actually in my rental car in Wisconsin. I just left IPC's warehouse, and then we're heading to our manufacturer because we're launching, as Breck mentioned, Breath Rocks at NCPA in a few weeks. And so what Breath Rocks is, it's a popping breath mint. So if you can think of sugar-free pop rocks with zinc, that's what this product is. So it is a fantastic product that, I mean, literally everybody is just, it's a wow type of a product. It was originally sold through QVC, HSN, Facebook. They had a big $30 pack of 9 of these, and they sold about $3 million worth, but they had it in, a packaging that really, frankly, kind of underwhelming. So we came in and bought the brand. We rebranded it and put it in black bottles, kind of like the old pop rock style, to kind of tap into that nostalgia. And so it retails, initially it'll retail for $3.49. It'll wholesale for $1.79. So there's a 50% margin. We will be able to get that price down. That's part of the reason I'm coming to our manufacturer in about an hour. We'll be able to get that retail price down to $2.99. And so this really is what we kind of consider the Red Bull of breath mints. It's something that it's not just fun and flavorful, but it's really functional. So it's not like candy anymore. The second thing I want to mention is the opportunity. We have raised over $100,000 of our $300,000 seed fund, and that's come from pharmacists just like you. So, in pharmacy industry folks. So it's Pharmacy Badass Lisa is one of our investors. We have Cliff Holt, IPC board member. We got industry veteran, Bruce Nealon, things like that. So their investment has helped us to be able to go into production so we can launch in a couple of weeks. And with this investment, if people invest, they get 125% back from our crowdfunding. Plus, they actually get a 2x amount in our crowdfunding, because what the crowdfunding does, it allows average consumers, your staff, to be able to put money in even as little as $100, so they can really be even more evangelical than they would with this product. But I had a pharmacist that we sent this to last week, and she said, she's like, oh my gosh, my staff loves this. She says, I got one of my pharmacists is addicted to it. And I said, well, I think we've just created a shrinkage problem for you, because this is such a fun product. So would love to talk with you if you're interested in investing. Would love to talk with you if you're interested in carrying the product. And I can send you samples now, or definitely we'll see you at NCPA in a couple weeks. So glad to have this opportunity to talk about Breath Rocks, and really just with pharmacies, you shouldn't be just selling, candy and things like that. You should really sell something that's functional. And the zinc in this product, it blasts bad breath with zinc because it's neutralizing the gases in your mouth that causes bad breath.
Tastes amazing. Tastes amazing. Thanks for sending me a sample. And I can see how others are going to like it as much too. It's amazing, and it doesn't have any sugar in it. Also, Jonathan is a advisory board member to the Fountain of Youth program as well. So I want to welcome him. Please get in contact with him, get a sample, or just get it ordered for your pharmacy. I think this product's going to really take off. It's amazing. So his contact information, I'll put it up in the chat for you too, so you don't have to write that down. The 15th revenue stream is a natural way of curing dry eye. And this manufacturer will actually send you a couple of these for free. So reach out to me if you have any dry eye patients. Also wanted to turn some time over to Tom because Real Value, if you guys aren't using Real Value, you're missing out. These guys are absolutely saving so many of our community pharmacies on their, in fact, I've got a pharmacy partner up in Scottsdale that doesn't use them as a secondary. They're their primary supplier for medications. But Tom, why don't you tell us more about your program?
Yeah, and I'll be very brief. I understand we're getting over here. So we are a national secondary wholesaler. We're one of the bigger ones, and we're based in San Antonio, Texas. We ship to all 50 states next day. We carry about 5,000 generics in our warehouse, and I will tell you, they are all competitively priced. We have a team of about 10 analysts that are constantly making sure we're carrying the right items and at the right price. So, you can even compare our pricing to the trade sites and things like that, and we're always going to be competitive. We are NABP accredited, so I want to make sure you know that, and we are fully going to be ready with serialization. I know that serialization was pushed out a year, but it really isn't. We're still working on it, and everyone else should be. And we're going to talk about that at NCPA at our booth a little bit too, just to kind of help the pharmacists out. We have generous credit terms, probably one of the best in the industry. And we do have controls, C2s through 5s. And what the biggest thing I want to leave you guys with is how we differentiate. Pharmacies get calls from wholesalers every day, multiple times. I can save you 10 cents on lisinopril. That's the old days. That's not what our sales reps are. Consultants. They talk to you about your business, what you're dispensing, and it's half or more of the items that pharmacies dispense are underwater. So we will carry multiple strengths, multiple manufacturers, because coverages are different throughout the country. So we're not afraid to carry 4 manufacturers, knowing it's going to help different parts of the country. And then beyond that, we talk to you about your product selection. Looking at changing from a cream to an ointment, could be a negative script to a positive script, an oral solid to a suspension, things like that. Those are strategies that you can just turn those negative scripts into positive ones. And then if you really want to get on the program with us, we do have a strategic partner in EasyScript RX, where it can pretty much tell you, by the patient information, what they're covered for, what would need a prior authorization, and what's not covered. And it will also tell you what the lowest copay is for the patient. So it's a win-win for both the pharmacy and the patient. And there is a technology in that software that will automatically send prescription changes into the doctor. We do supply marketing materials to the pharmacy, and also we provide the pharmacy with marketing materials to doctors. So that's my real quick hit on that. Please come see us at NCPA. We have a very large booth there. I would love to meet not only the pharmacists on this call, but the vendors. Let's talk, see how we can work together. We will have a barista in our booth, so you'll be woken up with a cup of coffee. So, but please come visit us, and thank you for your time today.
Awesome. Thanks, Tom. Yeah, amazing program. That the product portfolio is what shows you what you, and what is it called when you get the provider to sign off on equivalent change of
The prescription optimizer.
Yeah, so you actually can get the provider to allow you to switch to a like what he said, a product that would either be more affordable for the patient, or it changes your reimbursement so that you're not having to dispense for, upside down. You're actually making a profit when you dispense. So amazing program. And then the very last thing here, and I know we're running really short on time, is Gordon Health Group provides health insurance solutions for your small business that can bring your premiums down by 40 to 50%. Her sweet spot is small businesses like 30 employees or less. So I can certainly get you in contact with Cindy Gordon if that's something of interest, just as a cost savings for you, not necessarily a revenue generator. But those are the 16 revenues that we wanted to share with you. There are more coming. There's another medical device that's being piloted right here in Arizona right now that's going to be amazing once it hits the market. That can be plugged right in to the pharmacy. Doesn't take any additional manpower or any staffing of the medical device, because the patients literally just come in with their phone and they scan the QR code and it turns it on for them. They get the treatment and then they walk out, and the next patient comes in, does the same thing. Amazing program that's going to generate not only better health for patients, but more revenue for our community pharmacies. Please save the chat to get all of our contact information. You simply just need to click on the chat button, and at the very bottom next to the little emoji smiley face, you'll see 3 little dots. Click on those 3 little dots and save the chat so that you'll have all of our contact information. And please reach out to us to get enrolled in any of these programs that are of interest to you. Absolute necessity, get set up with the home health test immediately. That's something that is going to be very beneficial, not just to your pharmacy, but to about 65 million patients. CDC says there's like 33,000 new cases per day. That's over 12 million cases a year. And be a part of the solution. So let me know. I'll get you on the waiting list. You can reach out to me. My contact information is in the chat. Thank you, everybody. I sure appreciate our presenters for being here. Thanks to all that have presented and also participated. And please let us know how we can help you. Love community pharmacies. Thanks, everyone. Take care now. And we have this recorded too, so we will make it available for those that may have missed this. So, all right, thanks everyone. I've got to jump on another meeting. I'm late too.